International Cooperation in Korean Medicine.
In April 2013, I was standing on a ferry across Lake Victoria, Africa's largest freshwater lake. I was traveling to Kome Island, one of the largest islands in Lake Victoria, which has a population of about 50,000 people. The most significant health problem on the island was schistosomiasis, commonly known as liver fluke, a parasitic disease transmitted by snails in the water that live in the bloodstream and causes liver failure and other health problems. Due to its island nature and the lack of infrastructure such as electricity and running water, Kome Island had one of the highest infection rates in the region. People had to rely on the lake for living, which made them in constant contact with parasites. The reason I came here was to manage the parasite. Interestingly, it was the Korean parasitologist that I mentioned earlier that created this initiative. Based on the experience of the Korean Parasite Eradication Project, since the 1990s, Korean parasitologists have been working on international cooperation projects. One of those projects was this one on Kome Island in Tanzania. It was through that network I was able to come here. At the same time, it was also an example of how Korean medicine is finding its place in the world. With the creation of Korea International Cooperation Agency, KOICA, in 1991, Korea was transitioned from being a recipient of aid to a donor country. In order to effectively carry out its burgeoning international cooperation projects, the Korean government attempted to synthesize the Korea's past developmental experience. One of the key components of the knowledge sharing program was to create a policy advisory tool that would modularize the public sector policies such as finance and administration and social policies such as environment, human resource development, and health and welfare, and deliver them to recipient countries. Korea has arguably the most recent experience in this area of development, having moved from a low-income country in 20th century to a high-income country in 21st century. In a way, it is a country that can best fulfill the role of an intermediary between the two, as to have up-to-date knowledge of development.
Globalizing developmental experience.
One of these selected development experience was the Korean Parasite Control Program. The knowledge production system was created through the mass screening and mass treatment, generated a wide range of knowledge, skills, and experience for large-scale management projects at the national level. This management system, which originated in Japan, acquired contemporary meaning in Korea and created a new geopolitical position. The success of the Korean Parasite Control Program has also had an impact on the parasite ecosystem. That means that people worked on parasite had to lose their jobs. Unable to secure continuity in Korea, where many soil-borne worms has disappeared, researchers and activists have been forced to look for parasite abroad. This has not only ecological implication, but also geopolitical implication for Korea, which was emerging as a new donor country in the international community at the time. In addition, the growth of Korea's scientific and technological base from the mid-1970s onwards allowed for the appropriation and localization of treatment technology that had been delivered through transnational network of parasite control projects. These technological advances enabled Korean parasitologists to tackle new species and parasites that were previously unavailable to them. The experience and skills accumulated from late 1960s to 1980s laid foundations for the development of parasitological work in new environment. The praziquantel, a deworming drug introduced through the existing parasite control network, was localized by Korean chemists trained in US against the backdrop of Korea's technological-driven policy. The emergence of new synthetic methods from Korea significantly lowered the international price of praziquantel, enabling the development of a widespread parasite control activities globally. At the same time, praziquantel enabled Korean parasitologists to encounter parasites in new regions, including China and Africa. In the 1990s, Korea's Overseas Aid Program, which was a parasite control program centered on mass screening and mass treatment, was interpreted as a unique Korean experience. This enabled KOICA to move from hardware-oriented support projects, such as hospital construction, to software-oriented aid projects that communicate how the program should operate. In addition, Korea's experience of completing the parasite eradication program in 1995 provided the contemporary experience needed to rapidly introduce the program in developing nations. The events surrounding the praziquantel technology were made possible by the policy support of the Korean government, but they also owe a great deal to the transnational commercial activities of a private company, Shinpung Pharmaceutical. In the international cooperation project that began in early 1990s, technical resources such as praziquantel enabled Korean parasitologists and activists to create new transnational network. The business model centered on mass treatment and mass screening gave experience of large-scale control projects abroad in China. The subsequent Sudanese schistosomiasis control projects demonstrated that Korean experience could be replicated for other novel parasites that has never been encountered in Korea. My work in Tanzania also took this form, testing children across the island for parasites, mainly at schools, and treating them with praziquantel and using the accumulated data to convince the Tanzanian government of the needs for continued treatment. In overseas projects, we have applied a mass screening and mass treatment program similar to the Korean experience, which has become the basis for new knowledge production. From the mid-1990s until recently, the Korean agencies have been conducting international cooperation projects on parasite control in several developing nations, including China, North Korea, Laos, Cambodia, Sudan, and Myanmar. Currently, healthcare accounts for 13% of Korea's official developmental assistance, making it the largest sector of international development work. In monetary terms, it is expected to increase from 130 billion won in 2019 to 178 billion in 2022, with an average annual growth rate of 10%. Considering that Korea's share of official development assistance is relatively low compared to other high-income countries, this is likely to continue to grow. It is also a testament to the progress of Korean medicine that the government is using medicine as a key tool in its new role on the global stage.